Good afternoon and welcome to Webinar Wednesday. We're excited to have over 270 registered attendees for today's webinar, which is eligible for 1 credit from the ACI. Let's get started by giving one lucky attendee a Webinar Wednesday lunch bag for answering this trivia question. PartsSource, our sponsor today, is headquartered in Ohio. What is the name of the Ohio-born movie director that has Saving Private Ryan, Jurassic Park, and Jaws credited to his name? Answer now using the questions feature on your dashboard. While you're answering, I want to invite everyone to save the date to the MD Expo Fall Conference, October the 5th to 7th, which will bring HTM professionals from across the nation to Seattle for 3 days of learning, networking, and the latest advances in technology, products, and services. Details can be found at mdexposhow.com/Seattle. Okay, and let's see who the winner of our Webinar Wednesday lunch bag is, and it is Paul Graham. Congratulations, Paul. The correct answer is Steven Spielberg. Webinar Wednesday would like to thank our sponsor, PartsSource. PartsSource is the industry's leading provider of biomedical and imaging replacement parts through comprehensive technology tools. As a single source for parts procurement, their top priority is delivering outstanding service to clinical engineering, facilities, and supply chain departments. Visit partsource.com for more information. Our presenter today is Jina Tweed, Vice President of Quality Assurance at PartsSource. We would also like to welcome Erin Turneau, Vice President of Commercial Operations at PartsSource, who will be co-presenting today. Jina, you may begin whenever you are ready.
Hello, everyone. I am so excited to come to you to talk about quality in the supply chain and our approach to ensuring that we have quality in our supply chain. Today's agenda is establishing a quality management system, supply chain quality KPIs, evaluating suppliers, and applying a lean approach. What you'll learn, what I hope you'll learn, is best practices to evaluate quality in your supply chain, and how to build in benchmarks, ensuring ongoing quality. Okay. I am here because I am really passionate about quality. I've been in quality for 23 years, and I've been in it from a medical perspective, from design, software design, product design, as well as manufacturing, quality testing, and as an auditor. So I've been in medical device manufacturing for a number of years. I've also been in the aerospace industry, the industrial and aerospace industry, from a quality perspective. So I have a round view of quality, and I love quality. I eat, sleep, and drink quality, and the folks here at PartsSource can tell you that, because I'm always carrying the quality baton. Okay, why are you here? Quality matters. Quality in healthcare is essential for the health and well-being of patients and the financial well-being of organizations providing care. Quality remains at the core of everything related to healthcare. Measuring quality, improving quality, reimbursing for quality. In fact, most hospitals now include the word quality in their mission statements and strive to earn a high score in the 5-star quality rating from the Centers of Medicare and Medicaid. Quality is really important across the industry. As we look at the patient perspective in that continuum of quality care, we approach quality in patient care by looking beyond the point of care. The continuum of care is a concept involving the system of guides and tracks patients over time through a comprehensive array of health services spanning all levels and intensity of care. The continuum of care covers the deliverance of health care over a period of time and may refer to the care provided for birth to the end of life. Quality is also a top priority for medical parts. In fact, I'd say it's a critical priority for medical equipment. It has to be. It has to be an important part as the means of delivering quality from time of acquisition to retirement and everything that is done to that piece of equipment and keeping that patient care in mind. Quality has to be in the forefront of that medical equipment. So monitoring and ensuring quality at the medical replacement parts and repair services required to maintain extensive and vital patient equipment impacts to the quality and service, to the quality and safety of patient care.
Yep, and clinical engineering obviously is a critical component in this. Your job is keeping the equipment up. Equipment uptime is of the most importance. So ensuring that the products that you're receiving to repair that equipment are working as they should be and are up to specifications is a critical component to ensuring that that equipment is up and running and able to take care of patients in the way that's necessary.
Correct. Yeah. However, what we have seen is 1 in 4 hospital staffs report witnessing an expired or recalled product used on a patient. And we see that in situations where when I look at the FDA database, I look and see recall and safety information out there. So as we focus on continually monitoring the FDA recall and safety database to identify if there are potential products in the hospital that we have sourced through our organization, added to that list, we really focus on making sure that we notify our customers via what we call our quality assurance bulletins. So if we see that a supplier and a particular part that we've sourced is on that list, whether we've received notification from that supplier or not, we go ahead and make sure that we put together a quality assurance bulletin and send that out to all the customers that potentially purchase that part from us. That's our way of making sure that we keep the customer engaged in what is happening with that equipment. So when you look at it, medical equipment and the continuum of quality care, you look at it from where we source the medical equipment and the replacement parts to how that part is maintained and repaired to ongoing monitoring of that part. So given the key role that medical devices and other equipment play in the overall quality and safety of patient care, healthcare organizations often underutilize or they don't take the same methodical approach and care as much as they do with their patients with the parts, and they should with the equipment. I must reiterate, monitoring and ensuring quality of medical replacement parts and repair services required to maintain expensive and vital patient equipment impacts the quality and safety of our patient care. It's really important that we maintain that. So in our continuum of quality care for medical equipment, we have identified 7 major areas for improving quality. We're really going to focus today on 4 of those areas which are highlighted. We're going to look at the robust post-production monitoring and feedback, supplier management processes, quality metrics and management system, quality organization that integrates cross-functionally throughout the organization. Okay, so the industry, as you see, industry perceived criticality of quality risk in the medical system. This dashboard of the industry perceived risk areas of the product life cycle for medical devices, from product development to deployment in the field to post-deployment maintenance. What you see is a lack of focus on supplier management, which includes operating system, management infrastructure, and mindset and behaviors, impacts quality of the system. It truly impacts the quality of the system because so much happens in that area. It's critical to have a robust management process for the supply chain to make sure that we are interjecting quality throughout the process. So as we move forward in establishing a quality management system for the medical equipment and replacement parts, we're really going to take a focus on 5 components of establishing that QMS, and we're really taking a focus from the standpoint of looking at it from a supplier management perspective. Because of course we have to establish an overall QMS, and I'll talk a little bit about that later on down the train line. But when we talk about establishing these 5 component pieces of the QMS, it is from a supplier perspective. So hospitals can implement a continuum care approach of quality across the medical equipment. An evidence-based program plans, measures, tracks, and responds to the quality of medical equipment replacement parts and service by tracking return rates and by setting up controls across the supplier network, which is what we've done. And here are 5 of the areas in which we have focused on in our organization. Establishing standard operating procedures, which is a regular part of a quality management system. All quality management systems should have SOPs. We've also identified key performance metrics out there that are really related to, again, from a supply management perspective. You have overall key performance indicators, and then we have the specifics for the supplier management process. We also look at and implemented monitoring and measuring. We also do regular evaluating of suppliers, and then we try to make sure that we took a lean approach to how we implemented the supplier management process. So from a standard operating procedures, again, as I said, we're looking at this from a supplier and purchasing controls. And the reason I have it set up this way is because when you look at the standards, the ISO standards, it can either be 9001 or 13485. So supplier and purchasing controls are covered under both. So in looking at that and establishing the SOPs, we determine the protocols and procedures to be used, which is critical on how we're going to manage our suppliers. We identify suppliers during our evaluation process, and we have an extensive supplier self-evaluation, and we evaluate the supplier as well. We create an approved supplier list, and we identify on that approved supplier list what are the critical suppliers within that list, because you may have a litany of suppliers on your list, but what are the critical suppliers that, based on the type of part they provide, we need to have an awareness of them and extra pieces in place to manage those suppliers. We also have an established supplier corrective action request process. So when suppliers actually interject problems, we don't just get another part. If we got a bad part or a bad system, yes, we'll replace that for our customer, but on our side, we issue supplier corrective actions so that we can get to the root cause of what that problem was, and then put in corrective actions and preventative actions so that our customers, as well as ourselves, don't encounter a problem like that again. We also, as a part of managing our supply chain, we're continually vetting our supplier performance through the assessments and the audits. We do audits periodically throughout the supply chain.
And as part of our implementation with our clients, when we're onboarding a new client, what we often do at the very beginning stages of that implementation is we take a look and evaluate the client's purchasing policy. So, of course, every hospital has a procurement policy, but as part of our initial implementation, we always recommend reviewing that purchasing policy, and that could be a great first step in looking at, developing some SOPs. Is start with looking at your procurement policy. Is it up to date? Does it include some of the suppliers you want to exclude based on some quality experiences that you've had? Does it include your primary suppliers that you utilize for procurement? And does it take into account all the things that Jina mentioned on this slide? That's often a really great first step, is to review your current purchasing policy and make updates as needed.
Right. Right. And what we've also seen in creating that purchasing policy, as well as any contractual policies that we have, we look at that to see if there's opportunity for us to track additional metrics in terms of the quality of the product that is going to be provided to us by that supplier. So we really go through and look at how can we ensure that we get quality parts from our suppliers. So there are 3 questions that you should ask when you're looking at enlisting the services of a supplier. 1, is the supplier ISO certified, whether it's 9001, 2015, because that is what's required today, or if they're ISO 13485 certified. That's really critical to medical device suppliers. Being ISO certified 13485 says that they are really compliant with all the medical device regulations. The other question to ask is, how does the supplier manage product quality? Right? The quality management system that ISO and the FDA use in assessing the quality process of biomedical companies and medical device companies in general includes documents and record control, product realization, which in turn includes design, development, and manufacturing processes. You also have supplier management, corrective and preventative action, CAPA, and complaint handling and control of non-conforming parts. So you look at this and you ask that question, does that supplier really have product quality built in based on all those components I just mentioned? The third question that you ask, are the suppliers registered with the FDA for the parts they provide? It is a requirement that at least the supplier should be FDA registered. And if the supplier is FDA registered, it at least brings about a little assurance that they understand quality processes. Because a part of that registration that they do with the FDA, there's a series of questions that they have to answer. And a part of those series of questions allude to quality principles. So these are 3 critical questions that I believe that you want to ask your supplier or a potential supplier.
Agreed, Jina. And one thing that we want to reinforce is, this is your data. So when you look at and evaluate the suppliers from whom you're purchasing parts or accessories or really any product from, this is your data. So approaching your suppliers, whether you consolidate, with one supplier like us or you use hundreds of suppliers, at least looking at your top suppliers and understanding, what their quality performance looks like, answering all the questions that Jina proposed here are really, really important. But again, this is your data, so asking your suppliers for quality-related information and details around that is really, really important, and is all information that you should be proactively provided, and if not, that you should ask for and feel empowered to ask your suppliers for.
Right. Okay, after doing that, we looked at and we established quality KPIs. Again, these are quality KPIs from the supplier management side. So the quality KPIs that we deemed as important are parts return rate, returns during warranty periods, and customer service indicators. These quality KPIs are what we consider to be key for the quality of our business, which focuses on servicing healthcare organizations. However, these are not the totality of KPIs that you can have in place. These are some of the KPIs that we identified as critical for our organization and critical as it relates to identifying customer impact. So the quality KPI for parts return rate, which is parts return rate is critical to the quality, and this is something that hospitals rarely track in detail. They have a part that fails, they return it. They are not tracking this data within their system, or if they have a system, they're not tracking the data. And so what we see is a significant number of healthcare organizations leave such tracking of their to their clinical engineering departments. And some clinical engineering that we've encountered have been really good at attempting to track this information, but because of the numerous suppliers that a facility may have, when you're looking at a hospital, they may have 1,000 suppliers. Tracking that data can be quite tedious for an individual or even for a department, depending on how they track it. And often, the results in the fragmented data on various suppliers may not be the entire supply chain, right? So a better approach that we found was to centralize and standardize on monitoring of returns in the supply chain management. And so we have an entire system where we track the parts return data, very detailed data. So without accessing the industry benchmark data, hospitals can measure the return rate of a particular kind of part against the historical rates for the category for which it belongs, such as biomedical parts or imaging parts. That's if they have this data to track, right? So historical data that we're speaking about is more along the lines of having benchmarked data and reviewing that historical data so that the hospital, if they're tracking that data, they can compare their data to the benchmark and historical data out there and see how well a supplier's part or equipment is performing. But again, oftentimes this information is not tracked to this level because, again, the numerous suppliers that a clinical engineer would have to track in order to have this data. Also, seeking parts that have high quality ratings for mission critical devices. Again, it goes along with one, identifying, as we have, those critical parts suppliers, right? And tracking all the data that's associated with those types of parts. Not only tracking that data internally in our system, but looking outside, again, looking at benchmark data to see how those high quality ratings are applicable to the mission critical devices. And then lastly, looking at the returns during the warranty period. So looking at the types of returns here, which we're looking at DOA, which for us, when we look at DOA data, when we see the DOA, it drives us to question things such as the testing of a part, the packaging and shipping of a part, and from a service focus, we look at and review the experience level of a field service engineer. So we look at all those pieces as we're looking at DOAs to say, what happened here? And then of the early warranty failure rates, we track that over time so that we can, again, identify the suppliers and modalities that their products lasted through the warranty rate and those that did not hold up to the warranty terms. So, quality KPIs and customer service indicators. And this is from the field service perspective. One of the things that we look at is right the first time rate. Get that field service engineer that went out to do an install or deinstall, was that service done correctly the first time out, which is a pleaser for the customer, right? The other is the quality of the solution. Was the solution a quality solution, or did other things have to take place in order for the system or the part to be up and running? We also look at the response time. You know, not only how quickly do we get to the site, but how long does it take us to do the install or deinstall at that site? Response time is really critical for a hospital or clinical environment that has to be up as quickly as possible. We also look at the repeat calls for the same service. For us, looking at, yep, we've done an install here, we did it right the first time, we got through that, but then the customer has to call us back multiple times for that same service. We look at that to say, what didn't take place here, or what part do we need to make sure that we don't use in this type of instance. And then monitoring and measure every supplier and each part. We do this extensively. So first off, we seek ISO certified or ISO compliant suppliers across our portfolio. And the reason we do this is if we've got those suppliers that at least understand the ISO regulations, whether they're certified or not, but they have an understanding and they attempt to mimic that in their quality management systems, we are ensured that we will have at least a quality level built into those parts. Because based on what's required, there's some really defined steps that they have to do in manufacturing those parts. So we feel fairly confident that if we get the ISO certified or ISO compliant suppliers across our portfolio, that also helps to ensure quality. And then establishing critical to quality KPIs. Again, this is where those critical to quality KPIs are, we look at specific parts, what are those critical parts, what's the impact if those parts actually go down, and then what do we need to do in order to ensure that we have multiple supply chain options to service those critical to quality KPI parts. And therefore, we know that we are going to keep quality parts in our system. So as I spoke earlier about our extensive system, our proprietary system actually, where we capture and do data analysis continually. This isn't something that we do on a weekly basis or a monthly basis. We do it continually as it relates to our suppliers. So our supplier ranking module, we focus on our VRM, which is our vendor ranking module, and as a part of the vendor ranking model, we look at, we incorporate quality, call to fill rate, cost deviation, and vendor choice. And then on our choice program metrics, we look at the quality again, call to fill rate, and cost deviation. So the supplier ranking module is a platform that drives our purchasing decisions for parts requested when fulfilling orders. The SRM, as we call it, utilizes, as I said, the choice level and the vendor ranking module to produce a blended score that ultimately drives our online marketplace to display the optimum option for our customers. So we take the decision out of our hands and we put it into this proprietary system to use both our qualitative and quantitative data to then identify the best part to meet that customer's request. Here, as I said, we evaluate ourselves all the time. So one, we objectively evaluate the process by looking at, here's some data that we use continually to just say recall. We look at the recall data and what are the top products in the recall bucket. We see imaging and we see biomedical. So when we look at that and see the performance, and of course this is over time, we then look at our quality returns by product category that align with the top recall product categories. So we look at our categories by both imaging and biomedical. And what we do in doing the evaluation, as we look at the returns, we look at warranty failures, DOAs, poor quality, return for repair, not operating as required, and damage by a supplier. But what you see here is that we see the same type of alignment in our review of product returns or looking at the return numbers as we saw in the previous slide of historical information and ongoing information from a recall and safety perspective that says that imaging has a higher recall and safety area versus biomed. So we look at that and try and make sure that we have that understanding built into our system. So it's important, it really is important to find a benchmark to evaluate your own KPIs. This helps to validate and measure the quality of the process. It can also help verify trends and can also alert you to specific areas to focus on even more closely. It helps us when we think we understand something, we go and look at the data. If you're collecting data and it's quality data, data tells you everything. And so we look at the data to see, do we see the same thing that's seen out there in terms of recalls and safety? Because we want to see how we can prevent us from distributing potential quality issues. Okay, so taking the lean approach. Here, we looked at an integrated QMS across all business functions. And what we mean here is QMS, we have standard operating procedures across all the business functions. So each and every function we have, they have standard operating procedures and they have KPIs in which we manage the business. We also have established critical to quality KPIs, which is what I mentioned before, that provides quality performance of our suppliers. We're always looking at the performance of our suppliers. So the SRM and VRM for supplier quality assessment is critical for our business so that we keep a very close eye on how our suppliers perform. And we we use that in identifying the part when a customer comes online to make a purchase, or when you call up to source a part from us, we use that information. So the supplier ranking model, which ensures suppliers are selected based on unbiased, objective, qualitative, and quantitative measurements, is a critical component of our QMS, along with our KPIs, and of course, being ISO certified is critical for us, and being proactive in our auditing. What we do that I have not found happens in any other business, we do periodic audits of our suppliers' facilities. So if they are on the list of critical suppliers, we're doing an audit of that facility. We have the supplier do a self-assessment audit, and we then go do an on-site audit. Because what we are looking to do is verifying that the supplier does indeed do what they say they do, based on their certification, or based on their compliance, or based on them saying that they have a QMS structure in place. We verify that from our suppliers. So again, the supply chain, a supply chain that's built up of ISO certified suppliers, and utilizing an algorithm-driven quality system, and then having supplier report cards help us to better manage our suppliers. So in establishing our QMS, which I've mentioned a couple of times, we took several approaches. We digitized our QMS in the clouds. By digitizing the QMS in the clouds, this allowed all the business functions to have access to the SOPs at all times, and have access to the most current SOP, so that they're never working from an outdated SOP. And also having our supplier ranking module, our SRM, which is a platform that provides purchasing decisions and ensures suppliers are selected based on, as I said, unbiased, objective, qualitative, and quantitative measurements. And then the Supplier Scorecard, which is something that I believe is unique to us. We provide a supplier scorecard to each and every one of our suppliers. We calculate their performance, and if their performance does not meet expectations, we then work with that supplier to pull that performance up, or we work with that supplier to possibly move them out of the main line of supplier performance. We also, as I mentioned, we issue supplier scars. I'm very, very excited about the supplier scars that we issue, not because we're issuing scars, but because we've got a process that works, and that our suppliers are very responsive in addressing the scars. We give them a time to address the scars so that they can at least get to a root cause. And from there, we work on rectifying the problem, either in the piece of equipment or the part itself, or in their processes. But we work with them to make sure that that is addressed. And we have assigned, we have KPIs for our supplier scars as well. We limit the number of scars a supplier that's acceptable for a supplier. And then our quality solutions, again, it's really focused on our KPIs. Parts, our parts return rate, the responsibility of the clinical engineer, the benchmark for the vendor comparison, and centralized to prevent the fragmented data. And standardizing on monitoring is something that we do, as well as determining risk tolerance level and the use of low defect suppliers for critical devices. We look at, again, the returns during warranty period. We establish product registration process. We have determined acceptable failure rates and what's not acceptable, because you don't get perfect. So we recognize that. And then we have a regular tracking and monitoring and comparison process. And then thirdly, our customer service indicators. It's not last, it's just thirdly. We determine expectations for response time. We identify what should be sent out for repairs, and then we automate the tracking and monitoring of those KPIs. Here's an example, again, of how we monitor and measure. This is our scorecard that we use we have different scorecards. We have scorecards for product, suppliers that provide product. We also have scorecards for our repair vendors, as well as for our servicing, field servicing vendors. But this is a great example of how we keep track of our suppliers and their performance, and we send this out to each and every supplier.
One thing I wanted to chime in and mention is, a lot of what Gina's talking through that we do, a lot of it, is automated given the number of suppliers that we work with, over 6,000 in our database. So having an automated approach is really important for us for scalability and automation purposes. But really, the thing I wanted to mention was that all this didn't happen overnight. So it's, taking this methodical approach that Gina's outlined and, starting with a baseline, establishing where you are today, understanding what your suppliers, how they're performing from a quality standpoint, and establishing those baselines to start, like Gina mentioned previously, establishing those KPIs to start, and then working on improvements from there. So just wanted to mention, this didn't happen overnight. We've really been working on this for the past several years. Our focus on automation of quality and this evaluation process that Gina mentioned.
And as Erin just mentioned, we've been working on this for years, and this is an example of the quality focus that we have and the drive to reduce the return rates. So reducing that return rate ensures that we've got quality product out to our customers. So again, quality can improve over time with a continual focus. And you have to identify what are those things that you're going to focus on in order to drive quality. So continuous improvement. It should, even though we have achieved a fantastic return rate. It's one of the best in the industry. When you look at return rates across the industry, we have one of the best return rates. But even with that in place, we're always working on continuous improvement. We look at the expertise that we have in our business. We have over 300+ years of industry experience in our business, in supply chain and quality, in sourcing and procurement. We leverage the depth of our 3,000+ active suppliers. We have 4 million+ searchable parts. And then we have at least 1,300 catalog items and 300,000 parts processed every day that we go through. And then the scalability. You must build in scalability in anything that you do. So our best practice measure and management, we look at our supplier performance and we look at what are the things that we can do better? How can we improve and scale that? Quality and delivery and competitiveness. One of the improvements that is in place today that we are getting ready to roll out is how do we enhance capacity planning? How do we help our suppliers better assess their capacity for volume to provide to us as well as to others? And that's one of the improvement projects that came out of just looking at data, supply chain data. We identified, hey, this would be fantastic for our suppliers to have in hand is to do capacity planning and volume planning. So with that, our contact information, and please feel free, absolutely, to contact me with any questions, any feedback. As I said, I love quality, so I talk to just about everyone that calls me, that reaches out to me. And if you've got an opportunity for us to help you improve quality, you can contact me, and I'll see what we can do.
That's great. Thank you so much, Jina. I have got a few questions for you both. One question is, what should you do if a supplier falls below your standards?
Well, if a supplier actually falls below our standard, depending on what that is, we put the supplier on a quality improvement plan, which means that they're restricted, severely restricted in providing product to us that we then provide to our customers. So they are on a quality improvement plan, and this is a part of our supplier process management procedures, SOPs.
Yeah, and until those improvements are made, those restrictions stay in place.
Right, right. And that restriction can be anywhere from 90 days to a year, depending on the type of product or part that's provided.
Okay, that's great. So what should you do if a supplier is consistently outside of your quality KPIs?
What we do if a supplier is consistently outside of our quality KPIs, one, we have multiple sources, or we try to ensure that we have multiple sources, and two, we suspend them. We suspend that supplier from our supply chain, because if they're consistently falling below the established rate for them, that says that they have some process issues, some product issues, and that they have not taken a real focus to address those issues. So we can't afford to allow them to maintain a status in our supply chain, or an openness in our supply chain, because they then, as I call it, they inject a virus for our customers.
What can be done proactively before a supplier comes into the supply chain?
Well, one, the supplier self-assessment is one way of being proactive about the supplier before they come into the supply chain, because we get to get feedback from that supplier, but we also go out and audit the supplier to really see what their product is, their processes are, and how they handle quality. So that's how we proactively address a supplier before we even bring them into the supply chain.
Yeah, and as part of that self-assessment, sometimes on-site audits may not be, some organizations may not be able to do on-site audits. So as part of that self-assessment, questions that you folks can ask, your supplier are, what are your quality processes? So walk me through what happens from a time, a part is, picked to the time that it's tested and it's shipped. So having them at least verbally or in writing walk you through their quality related process is a great way to approach that as well. If an on-site audit isn't possible.
Right.
Okay. So how can you ensure quality for every order?
Can you repeat that, please?
Yeah. So how can you ensure quality for every order?
Well, one, making sure that we're very clear on what the ask is, what the customer's request is, and capturing that information correctly, understanding what type of product they're requesting, what type of situation that the product would be used in is really critical. So the customer providing us clear information on the part and where that part is going to be used is very useful in ensuring that they will get a quality part.
Yeah, and as part of our, as Jina mentioned, as part of our assessment with our suppliers on the front end, our proactive approach, taking that proactive approach is very, very critical in ensuring you're going to receive high quality parts, but then that monitoring thereafter of their performance is also critical. So with our teams internally, if it's something that they are sourcing ad hoc, that same performance metrics applies to our products that are on-demand source and also applies to our products that are in the catalog. You know, for you folks on the phone and managing, you know, your clinical engineering shop and managing your suppliers, you know, having that self-assessment up front with your suppliers to understand their quality-related metrics and their scorecard is really important, and monitoring thereafter. And adjusting your procurement policy on an ongoing basis that meets those same requirements. So if a supplier's on an improvement plan, making sure that the purchasing policy reflects that as well.
Okay, so how should we handle a recall?
Well, as I said, depending on the supplier and the part, if you've received notification of a part or product has been recalled, if you receive that notification directly, you do you follow all the steps that are contained in that recall notification that you receive. If we receive the recall notification, we then internally create a quality assurance bulletin and send that out to all of our customers, telling them how to handle that recall, how to handle that part, how to contact that particular supplier to make sure that they either return the part or they get a replacement part. So either you follow the steps in the recall notification if you receive the recall notification directly, or if we receive a recall notification, we then in turn send you a quality assurance bulletin. We need you to follow all the steps that are inclusive in the quality assurance bulletin in order to handle the recall or safety item.
That's great. We're coming up to our hour now. So thank you again, Jina and Erin, for a really great and informative webinar. And obviously thank you to today's sponsors, PartsSource. Just want to remind the attendees that you can win an Amazon gift card for completing the post-webinar survey, which will appear on your screen shortly. You must complete the survey to obtain your certificate of attendance. For more information about our upcoming webinars, please visit our website, webinarwednesday.live. Thanks again for joining us and hope to see you next time. Enjoy the rest of your day.